Three little pills: Amlodipine, Losartan, Lisinopril. If one of these is sitting in your pill organizer right now, I need 3 minutes of your time, because today, right now, your body might already be sending you a warning sign, and you might be calling it just getting older, swollen ankles by the end of the day, a dry cough that won't go away no matter what you try, a wave of dizziness when you stand up from the couch. Most people brush these off. They blame their shoes, they blame allergies, they blame just having a slow morning. But what if I told you each one of these small symptoms is actually your specific medication talking to you directly, and ignoring it could land you in an emergency room, or worse, in a hospital bed recovering from a fall that never had to happen? Stay with me for the next 20 minutes. By the end, you will know exactly what your body is trying to tell you and exactly what to do about it. My name is Dr. Wilbert. I've spent the last 18 years sitting across from patients exactly like you. Men and women in their 60s, 70s, 80s, people who do everything right, people who take their pills every single morning without fail, set their alarms, fill their pill boxes on Sunday nights, and still end up confused, scared, and Googling their symptoms at midnight because nobody ever sat down and explained what these medications actually do once they're inside your body. This isn't going to be a lecture. Think of this as the conversation your doctor wishes they had time for, but almost never does, in a rushed 10-minute appointment where you barely get your shoes off before you're being shown back out. By the time this video ends, you are going to understand Amlodipine, Losartan, and Lisinopril better than most people who've been taking them for years. You'll know the difference between a symptom that's simply annoying and one that needs a phone call today. And that difference, I promise you, can change your life. Before we get into it, do me a quick favor. Drop your name in the comments below and tell me which of these 3 medications you're taking. I read every single comment that comes in, and I want you to know something important. You are not alone in this, even if it feels that way sometimes. Let me tell you about a woman I'll call Mary. Mary was 68 years old, a retired school teacher, the kind of woman who color-coded her grocery lists and never, not once in her life, missed a dose of medication. When her doctor added amlodipine to her routine for her blood pressure, she didn't think twice. One more pill, same category as the others, no big deal, right? About 6 weeks later, Mary went to put on her shoes one morning and they simply did not fit. Not a little snug. They did not go on her feet at all. Over the following weeks, it got worse. By 4 in the afternoon, her legs felt heavy, almost like she was wading through water just walking to the kitchen. Her socks left deep red grooves in her skin by bedtime. She started skipping her evening walks with her neighbor because walking seemed to make the swelling worse. And here's the part that breaks my heart every time I think about it. Mary started lying awake at night, Googling heart failure symptoms in women, completely terrified, completely alone with that fear, not knowing who to call or whether she was overreacting. She wasn't in heart failure. What was actually happening inside Mary's body was something far more common and far more manageable than anything she had imagined while scrolling through those search results at 2 in the morning. Here's something most people are never told in plain language. Amlodipine, Losartan, and Lisinopril all lower your blood pressure. That's where the similarity ends completely. They do it in 3 totally different ways, and that difference is exactly why the warning signs depend entirely on which pill is in your hand. Amlodipine is what's called a calcium channel blocker. In simple terms, it relaxes the walls of your arteries, the vessels carrying blood out to your body, so blood flows through with less resistance. Lisinopril is an ACE inhibitor. It blocks a specific chemical in your body that normally tightens your blood vessels. Block that chemical and your pressure comes down. Losartan is an ARB, which stands for angiotensin receptor blocker. It works on that very same system as lisinopril, but it walks through a different door to get there. And that small difference matters more than you'd think. 3 different mechanisms, 3 different side effect patterns, 3 different things your body might be trying to tell you. Once you understand that, you stop guessing about your own body and you start actually knowing. So let's go back to Mary's swollen ankles because I want you to understand exactly what was happening. In plain English, no medical degree required. Amlodipine relaxes the small arteries, bringing blood into your legs and feet. But your veins, the vessels responsible for carrying that blood back up towards your heart, don't relax in the same way. So you end up with an imbalance. More blood flowing in than flowing back out. That extra pressure builds up in the tiny vessels near your ankles, and it pushes fluid out into the surrounding tissue. That's it. That's the entire mechanism behind the swelling. It is not your heart failing. It is not your kidneys shutting down. In the vast majority of cases, it's simply a predictable, well-understood response to how this particular medication behaves in your body, but here's where it actually becomes dangerous. Not the swelling itself, but how people respond to it once they notice it. Some people see the swelling, panic, and quietly stop taking the pill without telling a soul. Their blood pressure creeps right back up while they feel like they made a perfectly sensible decision. Some people keep taking it but start cutting back on water, convinced they're retaining fluid. That is exactly the wrong direction. And on this medication, dehydration brings its own set of risks. And some people, like Mary, simply suffer in silence for months. They stop walking, they stop showing up to things. Quality of life slips away one small decision at a time. So what should you actually do if this happens to you? I promise I'll tell you in just a moment. But first, I want you to really picture something with me. If your legs feel heavy and puffy by the end of the day, drop a comment right now and let me know. You would be genuinely surprised how many people watching this video tonight are dealing with the exact same thing, sitting there in silence thinking they're the only one. Here's exactly what you do. Legs swelling on amlodipine is a conversation for your doctor, not a crisis to handle alone. Tell them what you're noticing. There are often simple, effective adjustments available. Changing the timing of your dose, elevating your legs in the evening, or in some cases, switching to a different medication entirely. Mary did exactly that. Within 3 weeks of bringing it up, she was back in her regular shoes, back on her evening walks with her neighbor. 3 weeks. After months of silent fear, the answer turned out to be that simple. All it took was one conversation she almost didn't have. Now let me tell you about a man I'll call Frank. Frank was 70 years old, spent nearly every weekend out in his garage woodshop, building furniture for his grandkids. When a dry, scratchy cough started up one spring, he didn't think twice about it. He blamed sawdust. Made perfect sense, given where he spent his time. The cough got worse at night, so naturally he figured it was allergies, maybe a touch of acid reflux. He tried cough drops. He tried antihistamines. He even bought an air purifier for the bedroom. Nothing worked. Not one bit. 11 months. 11 months of broken sleep before anyone finally asked him one simple question that changed everything. Frank, when did you start Lisinopril compared to when this cough actually began? He went quiet for a second, pulled out his phone, started scrolling back through his pharmacy app, counting the months on his fingers. The cough had started almost exactly 4 months after he began the medication. In nearly a year, he had never once made that connection. Not once. We worked with his doctor to switch his medication to Losartan, which works on a similar pathway but doesn't typically cause this particular side effect. The cough was completely gone within 2 weeks. 2 weeks to undo 11 months of disrupted sleep simply because somebody finally connected the dots. Now I need you to really lock in for this next part because it matters more than almost anything else in this video. A dry cough is annoying. It will disrupt your sleep and your patience, but it is not an emergency. There is, however, one symptom connected to Lisinopril that absolutely, without question, is. If your lips, your tongue, your face, or your throat begin to swell, especially if breathing or swallowing starts to feel difficult, you do not wait. You do not call the office in the morning. You do not take a Benadryl and decide to see how it goes. You call emergency services immediately. Right then, in that moment. This condition is called angioedema. It's rare, but it is absolutely real, and it can close off your airway far faster than you would expect, sometimes within minutes. A cough is a nuisance you can live with for a while. Throat swelling is an emergency that cannot wait. Please, burn that difference into your memory today. If nobody has ever broken down your own medication this clearly for you before, go ahead and hit that subscribe button right now. Because what I'm about to share with you about Losartan could matter every bit as much as everything you've heard so far. Here's a danger that doesn't come from anyone doing something wrong. It comes from people doing exactly what they sincerely believe is the healthy, responsible thing. Losartan can raise the potassium levels circulating in your blood. For most people, that stays in a perfectly safe range as long as it's being monitored. But here's the twist that almost nobody warns you about. Walk down the grocery aisle and you'll find heart-healthy, low-sodium salt substitutes sitting right next to the regular table salt. Many of those products work by replacing sodium with potassium chloride. So picture this, a senior who's been told by their doctor to cut back on salt switches over to one of these substitutes, sprinkles it generously on every single meal, every single day, all while taking a medication that's already nudging their potassium levels upward. Two things, each one sensible on its own, quietly stacking on top of each other. High potassium doesn't usually announce itself loudly. More often, it whispers. Unusual muscle weakness. A tiredness that doesn't quite make sense given your day. Cramping in the legs. A fluttery or irregular heartbeat. And sometimes, frustratingly, almost no warning signs at all, right up until there are serious ones. If you've switched to a salt substitute sometime in the last year or two, and you happen to be taking Losartan or Lisinopril, this is genuinely worth a conversation with your doctor. Not because the substitute itself is bad, just because, until this very moment, nobody had connected those two dots for you. Here's something that affects seniors more than any other group, and almost nobody ever talks about it. What actually happens to these medications when you get sick? Not hospital-level sick. I just mean an ordinary stomach bug, a few rough days of vomiting or diarrhea, or a brutal summer week with heavy sweating where your appetite for water just isn't quite there. When your body becomes dehydrated for any reason, the exact same dose that worked perfectly well for you yesterday can behave completely differently today. Your blood pressure can fall lower than it should. Your kidneys, already under strain from the fluid loss, can take a real hit. The medication itself didn't change one bit. Your body's internal environment changed around it, and the drug is suddenly operating in conditions it was never calibrated for. So here's a question I genuinely want you to ask at your very next appointment. What should I do with my blood pressure medication if I come down with a stomach virus and can't keep fluids down? It is one of the most important questions you can ask your doctor, and statistically, one of the least commonly asked. Now picture this scenario with me for a moment. Your knees are aching after working in the garden. Your lower back is stiff from sitting too long. So you reach into the medicine cabinet for the ibuprofen, just like you've done 100 times before without a second thought. It's over the counter after all. How serious could it really be? Here's the thing your kidneys don't know or care about, whether a medication came from a pharmacist behind a counter or off an open shelf at the drugstore. They respond purely to chemistry, nothing else. Combine regular ibuprofen or naproxen with amlodipine, losartan, or lisinopril, especially if you're also taking a diuretic, a water pill, and blood flow to your kidneys can meaningfully decrease. Add even mild dehydration on top of that combination, and the risk of real kidney injury rises substantially. This is not some rare, hypothetical scenario I'm describing to scare you. I see this exact situation play out in my practice on a regular basis. If you find yourself reaching for anti-inflammatory pain relievers, often for arthritis or joint pain, please talk to your doctor about safer alternatives. Acetaminophen, topical treatments, physical therapy. You don't have to simply endure the pain, and you certainly don't have to silently accept the hidden risk that comes with it. Now here's the one that worries me more than almost anything else in this entire video. That little wobble you feel when you stand up too quickly from the couch or get out of bed in the morning. The room tilts for a second, you grab the door frame or the counter, it passes, and you go on with your day thinking, I just stood up too fast. But here's what's actually at stake. In someone over 60, just a few seconds of dizziness is sometimes all it takes to cause a fall. And a fall is sometimes all it takes to cause a fracture. A hip fracture in particular can completely change the entire trajectory of a person's life, sometimes for years, sometimes permanently. This dizziness happens because your medication is doing precisely what it's designed to do, lowering your blood pressure. When you stand up quickly, your cardiovascular system doesn't get a moment to catch up. Blood flow to your brain briefly dips, and that's the lightheaded, tilting feeling you notice. The fix, thankfully, is usually simple. Rise slowly. Sit on the edge of the bed for a few seconds before standing all the way up. Hold on to something stable nearby. Just give your body a few extra seconds to adjust to the change in position. But if this is happening often or it hasn't improved after the first few weeks on a medication, that's not something to quietly shrug off. That deserves a real conversation with your doctor. If you're finding real value in this video, go ahead and type the number 7 down in the comments below. It's a simple way to let me know you're still here with me. Now let's clear up something that causes an enormous amount of unnecessary panic in households all across this country. Your blood pressure is not a single fixed number. It moves constantly throughout the day, shifting based on your sleep, your stress level, how much caffeine you've had, whether you're in pain, even how loud you were talking right before someone took the reading. One unusually high number on a morning after poor sleep does not mean your medication has failed you. One unusually low number after a hot, sweaty day does not mean your dose is suddenly too strong. What actually matters is the pattern over time. Same arm, same time of day. After 5 quiet minutes of rest, without rushing in from outside or talking through the whole process, when people react emotionally to a single alarming number, the decisions that follow are almost never good ones. An extra dose taken out of fear, a skipped dose because one reading happened to look fine, a frantic call to the doctor's office about a number that, in context, was completely unremarkable. Track it consistently. Bring the log with you to your appointments. Let the pattern guide the conversation, not a moment of panic. So here's what I really want you to walk away with today. Amlodipine, Losartan, and Lisinopril are not rescue medications. They're not something you take only when you feel bad and skip the moment you feel fine. They work through quiet, steady, day after day consistency, almost in the background of your life. Swollen ankles, a stubborn cough that won't quit, dizziness when you stand, muscle weakness after switching to a salt substitute that seemed like the healthy choice. None of these are random. Each one is your specific medication, speaking its own specific language, trying to get your attention. Now you actually know how to listen. You don't have to be afraid of these pills sitting in your weekly organizer. You just have to genuinely understand them. That is the entire difference between Mary lying awake at midnight alone, Googling heart failure in a panic, and Mary calmly picking up the phone the next morning to call her doctor. That calm, confident version of you, that's exactly who I want walking away from this video today. If this video helped you understand your own medication a little better, please subscribe to this channel. Next week, I'm going to walk you through the one common mistake seniors make with their home blood pressure monitor that quietly throws off every single reading they take. You're not going to want to miss that one. And before you go, I want to hear from you. Tell me in the comments below, which one of these warning signs did you recognize in yourself or in someone you love while watching this video? I'll be reading every single answer. Take good care of yourself this week, and I'll see you in the next one.